When COVID-19 first emerged in Wuhan in China, Dr. Branley was dispatched to help evacuate Australians. Back at home base at Nepean Hospital, he was the expert called in when the virus struck at Newmarch House.
The working arrangement for management of COVID-positive patients in Nepean Blue Mountains had been to admit them all to hospital in the home.
That meant treating elderly residents who'd contracted the virus at the care home.
Discussions about moving patients represents a real risk of spreading this virus to healthcare facilities, and healthcare facilities act as amplifiers of this virus in society in general.
He referred to the experience in Victoria, where many aged care residents have been transferred to hospital and where more than 1,000 healthcare workers have now contracted the virus.
I'll be very interested to look at Victoria when the Victorian situation has been fully analysed.
Also giving evidence was the head of Anglicare, the man in charge at Newmarch House. Grant Millard described the desperate struggle to source enough personal protective equipment for staff. New South Wales Health told him it was not in a position to help.
Inadequate supply of PPE upfront meant that many of our staff in the initial stages were either infected or listed as close contacts.
Within days, they'd lost nearly 90% of their workforce. In the chaos that followed, many of the families say they were left in the dark. Virginia Clark's 94-year-old father, Ron, was one of the 17 residents who died.
Communication needs to be better, and our elderly need to be protected. It's not fair what happened to my dad and other residents at Newmarch House.
The hearing continues tomorrow. Ursula Malone, ABC News.